Good afternoon, good morning, and good evening to everyone on the line. I am very happy to welcome you to our webinar, Evidence for Social Protection Policy, Introducing the Social Protection Initiative. My name is Emily Romano, and I am a policy manager at the Abdul Latif Jameel Poverty Action Lab, or JPAL. At JPAL, I manage our new Social Protection Initiative, which we recently launched in collaboration with Evidence for Policy Design to fund policy relevant research on social protection programs in low and middle income countries. Today, we will hear an overview of the Social Protection Initiative, a discussion of why this social protection work is important for policy, and a panel discussion with policymakers and researchers about their experience working on social protection programs. Before we kick off this exciting agenda, I would like to provide a brief introduction to JPAL and Evidence for Policy Design, as well as an introduction to our speakers. So as I just mentioned, the Social Protection Initiative was jointly established by JPAL and Evidence for Policy Design, or EPOD. So who are we? JPAL is a global research center working to reduce poverty by ensuring that policy is informed by scientific evidence. Anchored by a network of 261 affiliated professors at universities around the world, JPAL conducts randomized impact evaluations to answer critical questions in the fight against poverty. Our global office, where I work, is based at MIT. EPOD is a research initiative based at Harvard that brings analytical insights to the design and implementation of policies and programs worldwide. EPOD engages with partners to identify key questions, design new interventions, and test these using tools of applied microeconomics, including randomized experiments. So next, I'd like to introduce the speakers for today's event. So we'll start off our webinar with an overview of the Social Protection Initiative from Professor Rima Hanna. Rima Hanna is the Jeffrey Chea Professor of Southeast Asia Studies and Chair of the International Development Area at the Harvard Kennedy School. She serves as the Faculty Director of Evidence for Policy Design at Harvard Center for International Development, is the Co-Scientific Director of JPAL Southeast Asia and Indonesia, and is co-chair of the Social Protection Initiative and the Social Protection Sector at JPAL. Her research revolves around improving the provision of public services in developing and emerging nations, particularly for the very poor. In addition, she is a research associate with NBER and a BRED affiliate. She is currently on the editorial board at the American Economic Review and previously was on the board of Review of Economics and Statistics and BoxDev and serves as a co-editor at the Journal of Human Resources. She holds a PhD from MIT. Following Rima's introduction to the Social Protection Initiative, we will hear from Lisa Hannigan about the Australian Government Department of Foreign Affairs and Trades, or DFAT's, support for the Social Protection Initiative. Lisa is the Director, Social Protection at DFAT. She leads a team on social protection that provides technical support across the Indo-Pacific to DFAT country programs, develops policy, and builds capacity within the Department on social protection. She is part of the management team of the new Partnerships for Social Protection program, which provides support and knowledge sharing for the rapidly expanding social protection agenda in the Pacific. Her team supports knowledge generation and dissemination in under-researched areas to ensure policy and programming decisions are underpinned by evidence. Lisa has economics and international development degrees from University of New South Wales and University of Bath, and postgraduate qualifications in social protection from the Australian National University. After Lisa's remarks, we'll move into our panel discussion. We have three panelists for today's session: Kurfi Abubakar Muhammad, Alejandra Candia, and Benjamin Olkin. Dr. Kurfi Abubakar is a medical doctor with a master's degree in public health and an MBA in international healthcare management. He is presently a Deputy General Manager and Head of Policy Planning and International Collaboration Division of the Nigerian National Health Insurance Scheme, or NHIS. His major responsibility is to coordinate and implement interventions to advance the course of universal health coverage in Nigeria. In addition, Kurfi also convenes health and social science research under the NHIS with a focus on strengthening the health financing system in order to improve the functioning of the health system. Alejandra Candia is the former head of the Secretariat of Social Evaluation at the Ministry of Social Development and Family of Chile. In this position, she played a key role in the government's response to the COVID-19 pandemic, especially regarding cash transfers and employment subsidies. She was also in charge of executing and adapting to the complex sanitary restrictions, the application of CASEN, the most important socioeconomic household survey that allows characterizing poverty in the country. She has a Master in Public Administration and International Development from the Harvard Kennedy School. Our third panelist is Benjamin Olken, who is the Jane Berkowitz Carleton and Dennis William Carleton Professor of Microeconomics at MIT. His research focuses on the public sector in developing countries, including work on social safety nets, taxation, and governance. He has worked extensively in Indonesia for over 20 years, as well as in other contexts. He earned his PhD from Harvard University. He is a director of JPAL, a co-scientific director of JPAL Southeast Asia, and a co-chair of the Social Protection Initiative and Social Protection Sector at JPAL. He is also the editor of the American Economic Journal Applied Economics and the co-director of the NBER Development Economics Program. So now that I have introduced our distinguished speakers, I would like to turn it over to Rima Hanna, who will introduce the Social Protection Initiative. Rima, over to you.
Thank you so much for being here today. I know it's a bit of an odd time. It's very early in the US, it's very late in Australia, but we were trying to encompass most of the world, and this was the best time. So I thank you all for making the time to really join us today and really engage with us today. And I'm also, I want to thank Emily for putting together the event, and for all of our speakers for being here. I'm super excited for our panel. For me, this is this is a very special day. It's the launch of our Social Protection Initiative here at a combination of JPAL and EPOD, where we where I just feel like this is just such an important topic, and such an important topic for the world today. And so I'm so excited to be part of this. And so Emily, if we could turn to the next slide. And the motivation for all of this work really came out of the COVID crisis. I've been working myself, Ben Olken, who's also here and will be part of our panelists today, I've been working on this topic for many years. And we, suddenly when COVID hit, there was such a focus on social protection, both in the US where I live, but also many, many countries worldwide. So 223 countries or territories had planned or implemented social protection measures, implemented cash transfer programs and food distribution systems and other types of insurance programs to really try to help citizens through this crisis. And we were getting a lot of questions at that time about what does the evidence say about how to best design these programs, how can we think about rolling them out quickly, but in a way that really makes sure they reach citizens and really make sure they're reaching citizen needs. And so we were thinking a lot about the evidence and thinking about what is there and what is missing and how to bring it together for COVID. But then it's beyond that, social assistance programs had already been growing in a lot of low-income and middle-income countries even before the crisis, and really becoming an important part about how we think about anti-poverty programs or anti-poverty initiatives around the world. And so putting this all together, we really felt the time was right now to take a step back, think about what does the evidence say about these programs, think about what are the questions that policymakers are grappling with today and see themselves grappling in the next few years, and how do we bridge this all and bring this together. And so maybe we can turn to the next slide. Thank you. So as a result of this, we decided with generous funding from DFAT and private foundation to start to think about trying to bridge the evidence in the policy space even more. And so we set up the social protection initiative with a few key priorities in terms of our work moving forward. So the first is we really want to review the evidence that's out there. We don't want to reinvent the wheel. We want to review the evidence, put it together, think about what it means, and make sure that the results really get out there in the hands of policymakers. The second part is that once we review the evidence, we really want to be thinking about what are the gaps in our knowledge. And then we want to connect to policymakers about those gaps and think about which are the most important, which are ones that practice has already answered versus where really research is needed. And so we want to try to understand what are the evidence gaps. And from there, we want to try to generate new research through funding competitions, which I'll talk about in a moment. And then finally, as this new research is being developed and out there, we want to make sure that in the end, it is the end users are not just academics in their office, but also policymakers in the real world, so that the knowledge can be part of the public debate and be used to try to think about how do we improve programs, particularly these programs that are trying to reach the most vulnerable in society. So can we go to the next slide, please? So as I said, the first thing we're doing is really thinking about the evidence, thinking about what do the design of these programs currently look like in a wide range of countries across different income levels, across different institutional levels. Then we want to think about what are the research projects that have been done, how do they address different components of program design, in terms of thinking about outreach. And along this, as we're putting together the evidence review, we're really characterizing the evidence along three broad themes. The first one is, well, we would like to think about who are the ultimate beneficiaries of these social protection programs. Who are the right people we want to reach? And that might be different for different types of programs. It might be different for a cash transfer program for the very poor versus an active labor market program that is trying to help people transition from one sector that is not doing so well to another sector. And so we really want to be thinking about who are the right people to be reaching for different types of programs and making sure that they get included under these programs. The second is thinking about the policy design. What are the right types of programs? What is the right type of mix of programs as you're thinking about the system as a whole in order to provide protections, particularly to the most vulnerable of society? And then the third is, well, we know that poverty is not static. There are some people who might have a very bad life circumstances and need a lot of help, but there are also people who move in and out of poverty. And oftentimes this move in and out of poverty is a reaction to shock. So I might be doing very well, my family is in the middle class, but then there's a very bad health shock to the main income earner, and that plunges my family into crisis. It might be that I'm doing pretty well, but for some reason my company had to let go of 10% of their staff, and I need some time to be looking for another job. And so these shocks often, especially for people who are in the newly middle class, can really drop people back into poverty and make it very hard to get out. And so the third component of this is really thinking about how do we help people handle these shocks that come their way and make sure that it doesn't lead to long-lasting negative consequences in the future. Okay, so the next slide, please. So as I said, so the first part of this was really the evidence review. We don't want to reinvent the wheel. We want to see what is the best knowledge, what is the best state of the knowledge out there, and try to bring it together, try to analyze it, try to think about what it means and think about how it could be used for policy. The second part is really then to say, well, once we figure out what the evidence gaps are, can we think about innovations and research and help direct research in those areas and help fund the research in those areas, providing support from an intellectual point of view, but also funds to get the research off the ground. And so as part of that, the initiative, we'd like to help commission new research. We're hoping to do this globally, although with our work with VFAT, we're going to prioritize countries in Southeast and East Asia, South and West Asia, and the Pacific. And so we're hoping to hold funding competitions for research studies about once to twice a year. Next slide, please. And the third component, as I said, is then we really do in the end want to make sure that the ultimate user of the work is the policymaker. And so part of what we want to do is try to hold more events like this, where we bring people together to have real discussion about the policy agenda and social protection. We want to try to take a lot of the work we're doing around the evidence review, around new research, and make sure that it gets to the right people through outreach and communications projects. And we really want to try to work harder to connect between academia and research and the policy space to really make sure that people have the tools and the information and the knowledge to be able to do the best they can in terms of designing policies and programs. And as I said, for me, this is just so important because these social protection programs are really, really, they're geared towards helping the most vulnerable in society. And I really feel like we have a duty and a responsibility to do the best we can in terms of making sure that the programs are really effective in terms of helping people. Next slide, please. Okay, so as I said, we've been really thinking about the agenda with 3 big buckets. These are really broad with many, many, many questions. But just to give you a taste of the kind of questions we've been grappling with and really thinking about, and we've been debating about the trade-offs between more universal programs versus more targeted programs. When we think about who should these programs, these cash transfer programs, these redistribution programs, and so forth, actually be reaching. We've been really thinking about, in a lot of programs around the world, they're doing the best they can in terms of trying to reach the poor and to provide assistance to poor and vulnerable households. But nonetheless, there is exclusion error. There are people that you really want to reach, but for multiple different reasons are not included in the role. So really thinking about why does the exclusion error exist and how can we bring those people into the fold. The second bucket is really thinking about program design and impacts. Here, there's lots of different questions about how do we know the details really, really matter in program design. And so, for example, if we're thinking about designing a cash transfer program, it's not just saying we're going to give a cash transfer program, but it's how much do you give? How frequently do you give it? What are the mechanisms? Are you doing it through cash through the postal service? Or are you doing it through digital transfers? How do you verify that the cash is getting to the right people? And even thinking about a lot of issues, for example, on gender, who within the household should receive the funds. And so really thinking through, even though a lot of these programs seem very simple, there's actually a lot of really fine implementation details that really matter in terms of the ultimate outcomes. And so thinking through those and how the research can inform those is sort of the second bucket that we're grappling with. And then the third is, as I talked about, is helping people respond to shocks. It could be unemployment, it could be health, narrative climate shocks, particularly where many people are engaged in agriculture, are very important. And in this category as well, we think about, for example, refugees, shocks to the political climate around new shocks, war, and how do we make sure that the social protection systems can incorporate helping displaced people as well. And so anyway, so this is just a small fraction of the topics that we're going to be grappling with. But as you can see, at least for me, I feel like these are very, very important questions to be thinking about as we're thinking about how can governments, how can nonprofits, how can we best provide protection for the most vulnerable in society and make sure that they have a basic standard of living, but also investments in human capital and the tools to really transition well to labor markets and help invest in kids at young ages and so forth. So I think this is just so incredibly important. And so I'm really, really excited that we're here today to launch the initiative. And on that note, I'm going to turn it over to Lisa, who will talk next about how DFAT is really thinking about the importance of social protection for policy. Thank you.
Great, thanks, Rima. Sorry, good, my video is working. Thank you so much, and thanks everybody who's online. It's great to see so many people here. I won't be long. We just really wanted to give a sense of why a donor like Australia would want to support a social protection research initiative like this. Basically, at the highest level, it is just part selfish, but also partly a global good. And obviously the direct policy implications that it can lead to in partner countries. So in a little more detail, firstly, it really is about the influence we're seeing the evidence have. So we've had big crises before, COVID, but nothing like the social protection scale up that we've seen in the last couple of years. And Rima had a slide on that. But I guess from my position, I'm seeing this partly driven by there just being such a strong story to tell now on social protection that's backed up by evidence on all things like economic stimulus and poverty reduction and education access and affordability and nutrition and even intimate partner violence now. So we've always talked about social protection as being an investment, not just a cost. But I guess increasingly we can prove it. And we also have much better evidence on what social protection is not going to do. So not going to lead to a spike in pregnancies, and not going to, from cash grants, and not going to lead to a lot of spending on temptation goods to any great extent. So things like that. So I guess there's a comfort in what countries are buying when they're investing in social protection in a way that we haven't seen before. But we're not there yet though. So there's not a lot of research on a number of things, including like social cohesion, for example. And then even in areas where we do know a reasonable amount now, like things like intimate partner violence and social protection, there's regional pockets where it's not tested, where the evidence isn't accepted because it hasn't been carried out there, like in the Pacific. So yeah, still a way to go. I guess secondly, I've been seeing the value close up of the evidence on both the internal and the external side on policy making. On the internal side, so within DFAT, so to mobilize funding for social protection assistance in an entity like DFAT, we have a high level strategy. Social protection has to sit within that strategy. And to do that, we need to be able to be able to clearly demonstrate how social protection can fit for our strategy at the moment. Has an emphasis on stability, on economic recovery, and we draw on evidence that we have to show how social protection can fit within those pillars. And then on the external side, it's been incredibly useful to have the relevant evidence, including from RCTs to draw on to shift the dial in our partner countries. I know personally, I've used RCT evidence from the PKH conditional cash transfer program in Indonesia when discussing with government how a decently funded, functioning cash transfer program could shift the needle on stunting in a place like Timor-Leste. So having that strong evidence from the region has been just so useful to help get buy-in for reform. And then lastly, RCTs, as will be conducted through this social protection initiative, they really have a firm place in the mix of what is needed in this evidence space. So we need all sorts of evidence, but RCTs aren't always required, but sometimes they can really be the most influential because of that robustness. On the policy front, what I guess what comes out of this social protection initiative, I guess from my vantage point, is going to be most useful when there's that the greatest chance of I guess results being externally valid, or at least the RCT results in one context can create enough interest to do comparable research in different contexts. They spark the discussions, the interest. Also useful where we couldn't have gotten comparably influential, strong results from just a simple monitoring exercise or a review, and where that focus is on topics of really high relevance, where there's a real gap. We don't want to do yet another study on how to choose the poor from amongst the poor using top-down targeting if we're only going to have like really marginally improved results. So really focusing in on what would be most useful. Yeah, so I mean, I just feel so privileged to be involved in this this initiative. I've got high hopes that we can produce some really influential work. But that's enough from me. Over to you, to the panel. Thank you.
Great. Thank you so much, Lisa and Rima, for your insightful comments. I'm going to stop sharing my screen now because we are going to move into the next portion of our session, which is our panel discussion. The panel will be moderated by Rima. She will ask a few questions to each of our three panelists, and then we will take questions for the panelists from attendees. So as you're hearing our attendees respond to Rima's questions, please use the Q&A functionality in Zoom to share your questions, and we'll take a selection of those at the end. So Rima, I'll pass it back to you.
Oh, thank you, Emily, and thank you, Lisa. I want to comment as well. I do agree in this idea that, for me, it's the goal as well, the idea that we could produce new research, interesting research that helps improve the design of these programs. And so partly why I'm so excited about the panel today is we have three amazing speakers. So Kurfi, Alejandra, and Ben, thank you for being here. And who are working on different aspects of social protection in different ways. And so Kurfi is doing a lot of work on Nigeria's national health insurance scheme. Alejandra, as Emily said, worked on so much of the COVID response, but also just more generally social protection programs in Chile, which has a very different context than Nigeria. And it is, as I said, these programs look very different around the world, and we want to learn from different contexts and how one can inform the other. And then the third speaker is Ben Olken, who will provide the academic point of view and really think about how research in the past has been used to inform the design of these programs. So thank you all for being here today. I really appreciate that you're spending the time to share your knowledge and learnings with us. And so I'm going to start. I'm just going to dig right into it because I already have the questions I want to ask all lined up and geared up. So I'm going to start with Kurfi. And I know that you've been doing so much work with Nigeria's national health insurance scheme. So I was hoping you could tell us a little bit about the design of the scheme, the national health insurance scheme, but also and some of the challenges you've been thinking about in trying to provide health insurance to your citizens. So I'll turn it over to you, Kurfi, to start.
Okay, thank you very much. Good afternoon, good morning, and good evening all. The National Health Insurance Scheme in Nigeria is designed as a social health insurance system aimed to provide qualitative health care to all Nigerians, without suffering any form of financial hardship. The overall aim of the NHIS as an organization is to ensure the provision of financial protection to all Nigerians, both in the formal and the informal sector, using contributions from payroll and other subsidies from the government to provide health insurance to the poor and the vulnerable. In 2005, the NHIS was established, and since then we have made a lot of progress in trying to cover both the formal and the informal sector, with a very good result in the formal sector. but not too good result in the informal sector. For the formal sector, we can beat our chest to say that we have covered virtually every federal government worker, because the ease to which their contributions, their salaries can be deducted is very easy. However, the informal sector has been a very hard nut to crack for the social health insurance scheme in Nigeria. Some of the key challenges that we have really encountered in design and implementing health insurance in Nigeria include, number one, the weak or very poor primary healthcare system. It's always important to, it's one thing to assume that you can provide social health insurance and pay for the services, but if the services are not available in the hospital, so it's both a demand and supply thing. And the other issue actually has to do with the design of the system. It is ours is a voluntary health insurance, and so anything that is voluntary is difficult to actually enforce. However, we are in the process of revising legislations to ensure that our health insurance system in the country is mandatory. One very important challenge also that is really affecting us is poverty. There is a very high level of poverty in the country and high level of unemployment. I think the two are related. And so this has made it very difficult to collect contributions from the informal sector, and has also made it difficult to actually get resources to finance healthcare, because he who doesn't have cannot give. And another also problem we have is the complex federal nature of our system. So Nigeria operates a decentralized health system, a decentralized system with 36 states in the country, and so each of them have their own laws, and this actually makes it a little bit difficult to have a uniform, social health insurance system that's applicable to all. Another challenge is also poor funding for the health sector, and then data non-availability, and then poor quality of data and non-use of data for decision making is also a very huge challenge for us. But there's also a huge challenge that we're beginning to actually really appreciate now in the country. So recently, there has been this expansion in the social protection space, with a lot of interventions by the government, and cash transfers are going along, both conditional and non-conditional. A lot of cash transfers are ongoing for different vulnerable groups in the country. But these social protection initiatives are not speaking to the health sector. So the social health insurance sector and the social health insurance sector and the social protection sector, let me use it like that, are not really speaking to each other. So there is no coordination, and there is no harmonization and sharing of information for better decision making. And I think the last challenge, which I put as last, but it's supposed to have come first, is political commitment. So political commitment to ensure that universal health coverage is on the front burner of the country is something that we're always advocating for, campaigning for, and advocating for support to ensure that we have that political commitment to make sure that health is on the agenda of all our issues in the country. Thank you very much.
No, thank you. Oh my God, there was so much to unpack there. I think, I agree with you on this idea of political commitment, and part of the initiative is what we're hoping to do is try to bring attention to these very questions, try to bring attention and show the research showing how social protection can be effective and the different ways it can be effective in terms of both helping make sure citizens are taken care of, but also in terms of questions of how does social protection help improve the productivity of workers or so forth. And so really thinking through these issues as we try to unpack the political debate. And you raised a lot of questions that were interesting about the informal sector and about data. And I think I'm going to hold off on, I would love to talk about them. I'm going to hold off and maybe have Ben comment on them when we get to him on his turn. So I'm going to put them on hold for a minute. But what you raised, I think a lot of these issues about the formal and the informal sector and how it interplays with providing social insurance, I think is just a big challenge in many countries around the world. But before I get to Ben to talk about some of these topics, I had a question for Alejandra next. I know you and I have talked recently about your work. It was such a fascinating discussion. I feel like I learned so much from you. And I really found fascinating the work that you and others were doing, thinking about differences between providing cash transfers versus wage subsidies, and particularly around Chile's experimentation and in developing these wage subsidy programming. And so I'd love to hear a little bit more about the work that you were doing in this area, if you can share with us.
Thank you, Rima, and thank you for the invitation. First of all, to make it clear, I'm a Kennedy alumni, but I'm an MPA, not an MPID. So to get to put this in justice, so for the other students of the Kennedy School. And well, as you asked me, we in Chile have been working since 2009, approx, to find tools to improve and to improve the amount of workers that are in the formal market. As you were saying, you can play with the two tools, one, the cash transfers, and the cash transfers to help people, as we are going to talk about what we do in pandemia, but also these instruments that can help us and as a country to improve the formal work. And in that group, there are a lot of wage subsidies. We have a young people wage subsidy since 2009. We have a women labor subsidy since 2012. And in 2019, we start working after a very social conflict that we have in Chile we start working in a subsidy that improves the income of people and families without making distortions in the labor market, because there were a lot of demands that wages were too low to satisfy quality of life of families, and a lot of people were demanding raising the minimum wage. But as we know, that could be a very a problem to low wage workers and leave them without work. So we started a strategy to improve and increase the wage subsidies, so that in that way you can go with like a cash transfers that gets money to the formal workers without distortioning the labor market, and that is called ingreso mínimo garantizado, minimum guaranteed income, and it's very interesting because it's like a negative income tax, but in the part of the money that you gave to the workers, to the employee, without direct to the workers and without going through the employer. That's a very interesting part. So if you have a formal work, you can apply to this subsidy, and if you have a formal work with a wage with a wage lower than the threshold, that is low too. So it's not for all workers, it's only for workers with a wage under a threshold and near an amount, I think maybe $50. Let me check with maybe we in the middle we are talking. You give money, cash transfers to those workers, so you have to in a platform, in a digital platform, because the other thing is that we start working in a social conflict, and then come the pandemia, and in that design, obviously we have to design all the subsidies come in a digital way. So you have a digital platform where you can apply, you can show your wage that is checked with administrative data, and then you receive the transfer direct to your pocket without going through the employer. So that's a very interesting part of the design, and in that way you can go for it, improve the formal work. And also we have another wage subsidy, which is related to the going back to the labor market after the pandemia. It's called, it's very related with the cash transfers that we're gonna talk after. And it's a cash transfers that if you go back to the labor market after being without employment or inactive, you can receive this transfer too. So it's like only for 6 months, and it's explained by in that group that is away from the labor market because of the pandemic. It's a little higher for women. It's a little higher for people with disabilities. So it's like you can improve that segment going back to the labor formal market, and it's additional to the other subsidies that I'm talking about. So that's, I think, the complete scenery. And for talent, for future talent, I think that Chile can work in a strategy to group all these subsidies in one big one, looking the experience of the negative income tax, but that it's a very huge challenge in our country, because obviously you have different platforms, different state stakeholders that are working with one or other subsidy. So putting all this together, it's obviously can be a lot of efficiency, but it's not that simple, because you have to work a lot with how the state works in the inside. I think that's the complete panorama.
No, thank you. I think, you know, what you're, it struck me as I was listening to the description about how a lot of the way you were able to design programs is really made feasible by the information systems that Chile has in the background, and also the banking system and the digital system. So I want to dig more into that. I think I'll dig more into that as we talk about the next question on COVID in a bit. But first, I want to ask Ben, turn over to Ben for a moment. Part of, and especially, as I was thinking about, some of what the discussion with Curfew over the health insurance and some of these challenges we see more universally, some of these issues about, trade-offs between designing, a cash transfer versus trying to think about designing it as a wage subsidy, incentives to try to also help people formalize. And as we're thinking about a lot of these issues in terms of the design of these programs, I'm really interested in hearing your perspective on the state of research. Thinking a little bit about what do we know, what do we don't know, where more research is needed.
Sure. Let me say a few things on that. The first is, one thing, I agree with something that I think Lisa said in her introduction, which is I do feel like there are a couple of areas now where I think we have a pretty good sense from research of some things that we actually feel like we know. So for example, I think that Lisa gave some great examples of how do you even start to approach the basic challenge of targeting, of how do you identify individuals in a country, in lower middle income countries, which don't have kind of the wealth of data maybe that Chile has, but have a little bit more challenges. How do you at least, I do think there's some open questions there that I'll talk about in a second, but the beginnings of how do you think about, what are the trade-offs between proxy means test approaches where you use kind of, where you go and collect data and use that to identify poor households versus kind of community-based approaches and things like that. So I think we have some sense there of kind of what can be effective. A second area where I feel like we have a pretty good sense of the evidence is on cash transfers. So I think that just a sort of, if we compare to kind of where we were, I don't know, even just 10 years ago, for example, I think there's increasing consensus that actually cash transfers are extremely effective. That people, just to echo kind of what Lisa said, people spend the money in very sensible ways to sort of improve their welfare in a variety of ways. There isn't kind of a negative effect from cash transfers on labor supply, on how much people work, particularly if the cash transfers aren't conditioned on income, if they're sort of, conditioned on other things. And one thing that I think is increasingly apparent is that there are really important long run effects from these cash transfers as well. And so I think some of the evidence that I think is, I find kind of very persuasive, is from the historical United States, for example, looking back at programs that were introduced in the 1930s, for example, where we now have, can see effects on sort of, kids and sort of grandkids in some sense of some of those very initial cash transfer programs, showing that the effects can be sort of multi-generation, to the next generation or even 2 generations. So I think that and we're starting to see, that kind of time scale is sort of harder to do in kind of lower middle income countries today, but we're starting to see some longer run effects as well, or at least medium run effects. So I think that A second area where I think there's kind of increasing consensus is that cash transfers, although they're not a panacea and by no means the only thing one should think about, can be very effective. And I think that if you look at sort of, we'll talk about the COVID response in a minute, but countries all around the world, when faced with kind of the COVID crisis, turned to sort of cash transfers in a way that maybe they wouldn't have, before sort of this kind of global knowledge base had been there. The third thing I'll sort of mention of things we know is, there's some evidence that I think is pretty interesting from some of these asset transfer programs that suggests the possibility that the right combination of approaches can actually lift households out of the right set of households out of poverty kind of on a more ongoing basis. So these are programs, there's a series of programs pioneered by BRAC in Bangladesh, now evaluated in many countries, which gives sort of an asset transfer, often livestock, with a whole bunch of complementary training initiatives. And those programs seem to have pretty substantial long-run effects on households' incomes, even 5 or 7 years later. I don't think by any means we fully understand yet, these approaches don't work for everyone. Who do they work for? A bunch of questions. But to me, they raise the possibility that for at least a subset of households, there can be a subset, a subset of households, maybe sort of, there may be programs that actually can not just sort of support them, but actually have kind of transformative effects on their income levels. So I think that's not the goal of all programs, and I don't think is an appropriate goal for all households. I don't think all households are right, or that would make sense for all households, but understanding kind of for whom those could work and what other approaches like that could work, I think that's kind of initial possibility result, but I think sort of it also, I think, tees up kind of a whole bunch of new questions of how do you do that more broadly. I also though wanted to touch on some questions of things that I feel like we don't know, and actually part of the goal of this initiative is to answer questions we don't know. I was really struck in listening to Kurfi's talk about some of the challenges faced by health insurance in Nigeria, particularly how do you cover the informal non-poor sector. Rima and I, with our co-authors, have done research in Indonesia that was actually supported by DFAT, which was exactly on this topic. And just hearing you talk about the challenges you're facing in Nigeria, I heard echo after echo of the same challenges we see in Indonesia, and challenges, we've had some conversations with Philippines, for example, just hear the same challenges over and over again. And I think in particular for sort of lower middle income countries like Nigeria, like Indonesia, like Philippines, that are starting to sort of think about how do we expand, how do we think about providing a safety net to include shocks like health insurance, the same challenge comes up, which is to say, the formal sector, we can cover them through sort of requiring them to pay payroll taxes and deduct them at source. The poor, I think everyone kind of agrees, the government needs to sort of cover their health insurance. They're not sort of wealthy enough to be able to pay for it. The informal non-poor, though, who are wealthy enough that you want to that you'd like to collect some premiums from them, or otherwise you would have too many distortions between the formal and non-formal sector. How do you get them to pay is a real challenge kind of everywhere. I say it's not, in some sense, even countries like the US have struggled with the exact same issue. But I think it's a real challenge in sort of understanding kind of how do you crack that nut is, I think, a really important question, which I feel like is an open one. And if we tried a bunch of things in Indonesia that made some improvements but didn't solve the problem, and I think that sort of that's something that I just want to echo as a challenge that I think that we see as a very important one. Another thing that you mentioned, Kurfi, is the question about you mentioned sort of data updating and how do you find the question of if your data is not up to date, what do you do, and how do you identify who's poor? And I think that although Lisa said we know a lot about top-down targeting, I agree with that. On the other hand, I think one thing that the COVID crisis really sort of foregrounded for so many of us is a lot of the ways that we think about measuring poverty for identifying who should be eligible for these programs are based on kind of the long-run component of poverty, right? So it's based on things like your assets, for example, and those are, what kind of house you have, do you have a motorbike or something like that? Those kind of long run purchases reflect kind of your long run, expected income over a period of time. and don't respond very rapidly to shocks, right? So I could be living in a nice house, but have lost my job, and the data doesn't pick that up. And so I think that, related to what Kofi was saying, I do think understanding how to do this dynamic targeting and make those programs more responsive to shocks in kind of a not data rich environment is an important area. There's actually some exciting work that other people are doing on this, which actually I may talk about a little later, using sort of mobile phone data and otherwise. But I think that that's an important question. A third area that I think is really important is this idea that I sort of hinted at, that we may not want to have a one size fits all approach, that sort of different people may benefit from different types of programs. There are some people for whom a program like the asset transfer program I was mentioning before may be totally appropriate. There are other people for whom, say, a cash transfer program might be appropriate. There are other people for whom a conditional cash transfer may be appropriate. There are other people for whom other types of programs may be appropriate. And I think that most of the way that the thinking has been done is sort of saying, in, out, who's poor, who's not poor. But I think sort of understanding kind of how do we figure out if there are kind of heterogeneous treatment effects and which programs are most effective for which kinds of people, and doing a bit more sort of more nuanced kind of sort of getting the right people into the right program strikes me as something which I feel like there's a lot more work to be done on.
No, thank you, Ben. And you actually are getting us into our next topic. You were talking a little bit about what you learned during the COVID crisis, what you saw were the research gaps and evidence gaps as a result of, as people were trying to really scale up social protection very quickly. What did we not know? What did we need to know in order to do so? And I think that's the topic I want to turn to next. It's I know we're all so tired of talking about COVID, but we also know that it has been a big part of our lives the last 2 years. And social protection, social insurance was really a key tool that governments around the world, nonprofits around the world used in order to help people who are particularly vulnerable, both to the health effects, but also to the economic effects that we've seen. And so I want to start with you, Kofi. It'd be great to hear a little bit more about how your perspective about what Nigeria was doing in terms of social protection and insurance during COVID. What did you learn through the process that might make you think differently about the way we provide social protection and social insurance? And how has your thinking changed in light of the COVID-19 pandemic?
Okay, thank you so much. I think what has really affected, COVID-19 has affected every angle of healthcare delivery, both in the low middle income countries and even the developed world. For us in Nigeria, what has really shown us that COVID-19 has shown us a very serious crisis can actually affect. Number one is the interrelationship between health and other sectors. That became very obvious with the COVID-19 pandemic. We saw how, for example, the security sector can actually can affect the health sector. We saw serious disruptions to healthcare service delivery due to restriction of movement. We saw a lot of stigmatization of COVID-19 patients, a lot of closure of healthcare facilities, fear of infection by healthcare providers, lack of protection devices, and access to access to healthcare services became a problem. So during the COVID-19, not only did the healthcare become not available, but the quality of that healthcare that is provided also became very poor. So we are grappling both with a non-available healthcare, poor quality healthcare, and the resources to finance that healthcare was also not available. This also became much more accentuated with the other sectors, the social protection space. For example, there's so much worsening poverty, worsening inequality, worsening inequity, both in the gender dimension and the disability dimension, the age dimension, and the rest. And so we found it very difficult to actually provide, continuous care, in light of this, and also. So some things that actually we had to do, we had to begin to think outside the box. Number one, we had to mobilize the money to finance this healthcare. Mobilizing the resources is perhaps the most important thing. and the resources at that time were not available. Nigeria relies on petrol or oil, crude oil as a single most important resource. And if during COVID-19, crude oil became zero. It was actually 0 naira. So that was really a very serious crisis for us. And then the other thing also we had to find ourselves is that the issue of digital solutions to healthcare. So for example, now if people cannot come to the hospital, can the hospital come to them through telemedicine, e-health, and the rest? And if we deploy e-health and other telemedicine services, for example, who will pay? Is it the health insurance that will pay, and with which benefit package do you pay for those services? Using what provider payment option do you pay for those services? So a lot of policy questions came that we really couldn't answer. How do we rapidly adjust our benefit package to accommodate COVID-19 pandemic? How do we rapidly adjust our provider payment system to accommodate, COVID-19 pandemic and the rest? And then what services should we provide? And what should we not provide in view of the limited resources that we have at our disposal? For example, we can cover the test. Can you cover intensive care unit, ICU services, with our limited resources? And what trade-offs do you need to make? It's one thing, for example, to cover a COVID-19 patient, and then do you cover a COVID-19 at the expense of malaria, for example? When you have malaria, you have other very common infectious diseases in the country. So how do you adjust? What trade-off do you need to do? And of course, those people that before could contribute in the non-poor informal sector that could contribute, who have suddenly become poor because of COVID-19. Do you stop their insurance, or do you give them a waiver until when things get better? Those were very huge challenges that we had to really grapple with. But I think what is most important in the COVID-19 pandemic is that it has shown us that there is, first of all, the need for broader intersectoral collaboration across all sectors. Health cannot exist as an island anymore. We need to work with all sectors. The second thing, it has also shown us that health insurance is perhaps the single most important and sustainable way to finance healthcare. Abridged or stopgap measures of rapidly mobilizing resources to finance healthcare may not be the solutions to all. Nations need to invest in health insurance as a sustainable way to finance healthcare. And lastly, I think there is need for broader integration of the social protection sector. So for example, you give a Nigerian, an elderly woman, cash transfer of $100 a month or $50 a month, for example, and that woman falls sick and the entire money is wiped away by ill health. So how do we integrate the social protection space and the health insurance space? That's also another challenge that we grapple with. Thank you very much.
No, thank you. I think these are really interesting points. I agree with you that, oftentimes in some ways it's easier to think about things in buckets, to think about health insurance, to think about cash transfers, because it gives us an organized thing, but often there's a lot of synergies in how these programs are provided. I think also as well, it's something that I grapple with is that oftentimes there's not a lot of data sharing across ministries in order to do this kind of collaboration. And I think these are important topics to be thinking about and grappling with. But I do want to turn to Alejandra next. I know Chile did a very, very extensive response to COVID in terms of providing cash transfers. I think it particularly for me is very interesting as well in that Chile has a very, very good underlying data system, a very good banking system, and thinking about how these systems really supported being able to have a quick response to the situation, and how you thought about that, and how you thought about finding the right people for the response and connecting it to the systems. And so I'd love for you to tell us a little bit more about what Chile did during the pandemic, and also how the systems in play helped facilitate the work you were doing.
Thank you, Rima. Well, as you have been saying, you and the other panelists, maybe it's important to clarify this to the audience. Chile has a lot of administrative data, a very rich administrative data that is used in a way that we can identify and target the social policy that we have in the country. There are more than 140 social programs that use this information and the kind of classification that we do in the income distribution of the families, so you can understand the line, understand the priorities, and know if a family is in the first part of the line or is in the last part of the income distribution. But the challenge is that you know that about the families because you have the administrative data and you have like a formula that taking charge of this social economic classification. Maybe it's like calificación socioeconómica of the families. But the challenge is that indeed, we use a lot of administrative data to put this line in order. You also have data that you must know about the families from the families. So you have the families with their qualification, but only the families that has knocked the door of the state. Why I'm saying, because you have to know the composition of the family, the address, and a lot of data that you cannot infer from the administrative data. From the administrative data, you have you can infer the wage, you can know about the level of education and other data. Maybe the most important is the income, because you can the formal income, and the absence of formal income is treated as no income. So you have like make a balance. But why this introduction is very important for your question, because in the pandemic, we have like this data of the families that had knocked the door of the state, and you can use this data to understand in this pool of data and the pool of families, which families need before than others, or are first in line. But the problem of what we have to afford in the pandemic was that for one side, there were a lot of families that lost their incomes because they were informal, or because they were formal but they were not working at all in that moment, and they have never before knocked the door of the state. So they have to get in this system, and when you get in this system, that obviously remains some time. And obviously the income were needed immediately, because there was a lot of necessities that before they were not doing. So we have all this data that for the how do you say, the good part of the glass of water, the full part of the glass of water, you can administrate a lot of demands for people that you have there, and you understand their families. And in the beginning of the pandemic, for all the world, not for only for Chile, there was a lot of incertidumbre. How do you say that in English?
You mean uncertainty or no? No, sorry, go ahead.
Incertidumbre. Uncertainty. Yeah, there was a lot. We have not information about how long it's going to be the pandemic, how deep it's going to be the pandemic. You didn't, and for the other side, you have a fixed amount of fiscal incomes. So you have to administrate this with all this uncertainty, with all this not information. So that data help us a lot to Chile to first go to the families with more needs. and to administrate it in all the rest of the time, the families that goes in this system, and administrate also how you use these fiscal incomes, because obviously in the first beginning you gave more little to a very little amount of families because you didn't know how long we're gonna take this, and how many months we're gonna have to give money to the families and cash transfers and that. And then we start going on with a more aggressive cash transfers, and they began to depend. So we put also to administrate the limited fiscal incomes that every country has. So we began to make designs, for example, for families that live in places with more restrictions in terms of the health restrictions that were going, because as you know, Chile is a long and thin country, and obviously what was happening in the north in terms of the pandemic was not the same in the center, was not the same in the south. So families were more or less restricted depending in how deep was going the pandemic in one geographical area or the other, and so the cash transfers began to be obviously in the way to administrate these difficult and limited fiscal funds to go more deep in the places where were more needed. This was obviously complemented with other kind of transfers to the little enterprises, and ways to, for example, giving them lending them money with less restrictions, cash transfers to sectors of the country, for example, transport and other ones, but the how do you say, help me with the Spanish speaker, columna vertebral, the spine, the dorsal spine of the help that Chile was gave in the pandemia was the cash transfers that began very little because of all the few information that everyone in the whole world has about the pandemia, and they began to be more aggressive, and obviously with designs that very slow. They began, for example, in this think of areas, and in the end, more universal, considering that obviously the pandemic and the vaccines and everything was going on. So this use very, very aggressive of more universal cash transfers were new that where they were being used, not for that a long time. For the families, we obviously clarifying that we end giving these universal cash transfers that was costing $3,200 million per month. That's a lot of money for Chile. For the audience, if we can put it like in a picture, in 2019, without pandemia, we spent in the more visible subsidies in the country, not education, not health, not pension, but the cash transfers given for poor people, about $1,000 million a year. And only in the cash transfer for the pandemia, in the more aggressive part of what we gave, was $3,200 a month. So you can put this in the equilibrium. And we were very aggressive at the end, thinking about that we knew that there would not be more restrictions about going out because of the vaccines, and that obviously was for not a long amount of time, because obviously all this information and all this targeting and all the designs of social cash transfers for what we are talking about this morning here in Chile, morning at all, are obviously in a world that we have fiscal restrictions. We don't have a full pool of money. We have a restricted amount of fiscal amount of money. So when you have this restriction, you have to use this information to get first to the families who needs more, to get first to the places that were more restrictions, and in that way to use this money and this fiscal money that's not from the state, is from everyone, in the more efficient way to avoid the necessities of the population in moments so hard as they were in COVID-19 and pandemic in the world at all.
No, thank you. No, this is very interesting to think about the challenges you face given the uncertainty. I think for me, actually, what was very interesting about both the discussion from Murphy and the discussion here as well is thinking also, we often think about the design of these programs, but the underlying feature of all of this is the budgetary resources you have available. Thinking both through, strengthening tax capacity, but then also thinking through the budget constraints. How do you best think about which programs to invest in, which are going to be more effective? How do you think about, scaling up more assistance during bad times, conserving maybe in better times, and thinking really through these budgetary issues in the background. And, for me, it was also, turning to Ben's question next, part of where, at least for me, where I view the evidence space as being helpful to the policy space is really thinking about helping policymakers make choices when there are limited budget constraints over which policies and programs to invest in and how to better design them to be more effective. And so I wanted to quickly turn to you, Ben, and ask a little bit about how do you see the evidence space informing the policy space during COVID?
Yeah, sure. Let me give a couple of examples of that, and I'll try to keep it brief since I know we have a bunch of questions that we want to get to as well. So one example actually I think comes from our own work in Indonesia. And this is, I think, a nice example of how investing in sort of global knowledge can reap dividends sort of later, even if not directly. So we had done some work with the Indonesian government, I don't know, about 8 to 10 years ago on the question of community targeting and whether it was sort of an appropriate way of identifying kind of poor households who were in need and whether it worked in the Indonesian context. And we found actually that it was quite successful. That certainly it did about approximately as well as proxy means tests, and actually was better in some ways at sort of revealing kind of local conceptions of poverty and being potentially more responsive to shocks. And so during the COVID crisis, one thing that the Indonesian government realized is that because of the sort of the radical shift in sort of who was in need of assistance because of the COVID crisis, the people who were poor or in need of assistance today were not the ones who were there before. Plus, there was a lot of exclusion error. They sort of needed new approaches, and they actually, turned to that research that we had done, previously, and said, look, this seems like an important or a method of targeting that can be really useful, and actually sort of adopted that sort of at scale. They basically turned kind of an existing village fund into a village-based community targeted cash transfer fund, or at least allocated 30% of those village funds for that, and actually use those methods to give out assistance to approximately 8 million households, if I get the numbers right. So it's an example of how research that had been done sort of prior was able to sort of inform kind of how the government sort of responded to this shock. Another example that I think is pretty interesting comes from Togo, where they were also sort of struggling with how do we sort of scale up a cash assistance program, and in particular do one that's sort of a little potentially responsive. And there they worked with some researchers who had done some pioneering work in other contexts on using mobile phone metadata as a proxy for sort of identifying kind of who was sort of poor and who was not, and they were able to use that approach very quickly to do anti-poverty targeting in that context. So I think those are just a couple of examples of how investing in kind of this global knowledge base sort of paid dividends kind of when the crisis hit, and governments were able to use those policy lessons to sort of rapidly scale up in poverty during the COVID period.
Great, thank you. So I'm going to dig right in. We have so many questions, And I know we won't be able to get to all of them. And so I apologize if I don't get to your question, and I apologize. I'm going to also try, there are some with similar themes. I'm going to try to group them together and to try to incorporate more of the knowledge that everybody wants to gain. I think my first question is going to be to you, Alejandra. I think, you know, we've had a lot of discussion about workers in terms of thinking about social protection. And I think there were some questions about thinking about families and children and child protection services and how that fits into your broader thinking about social protection systems.
Well, obviously, we have a lot of challenges in terms of how the state can respond with this, with all this information that we have. For us, the pandemic was a very important lesson in terms of that administrative data is very useful, but it's not everything. Why? Because obviously you have you have data that is not immediate. You have, for example, the wage data is like 3 months ago, and you cannot use it in terms of when you have to react to a challenge as the pandemic was. We expect that we don't have more pandemics coming, but obviously this very special event in our world teach us how we can use and not use the administrative data for making and taking decisions. In terms of social protection, obviously, the challenge of families and to going through families, the challenge in terms of children, Chile has been working a lot about that. Chile has been working with a lot of priority, despite of the government, the last government, this government too, that they are from different sides, but we have the priority for children and social protection for them put in the center of the state, but not only the governments. And there's a lot of instruments that we have been developing, and they are going to still going I hope so, to go deep in this development in terms of how to you go and you go on time and you go efficiently to the families that have children that are in need of not only react in terms of what they need, but also prevent what you can do, because obviously prevention is always important. But when you prevent social problems in children, obviously you are making a lot of investment more interesting and obviously more how do you say, when you prevent in children, you are making a lot of investment for the future, not only for them, but also for the country. So there we work in the last government in terms of going through prevention and understand how you can, how can you can use the data to prevent and to give tools to those who are in the territory working with children, for example, municipalities, and also not only the state at all, but the local governments. They have the information that they can go and that they can have the information, so they can go and understand, for example, absence in school with a lot of time and to react to these signs that obviously you can make instruments and also give help with a lot of prevention that obviously can help to not only to design social policy to react when the things that they are obviously they are obviously without all the capacity to react before. I don't know if I'm explaining me that well, but I think there's a lot to do in terms of childhood and childhood care and childhood prevention. And obviously in that kind of social protection, you are doing a lot to react with a lot of time before when probably the problem is already there. and that investment obviously is not only for them, it's for the country, because all the system obviously is better when you can act with all the time before. That's it. Thank you, Rima.
No, thank you. I think this is incredibly important, both the gender and the youth and child protection services. And when I think about the research and moving forward, there's been great work, a lot of it out of IFPRI, looking at, for example, the interplay between social protection and intimate partner violence. I think there's more work to be done thinking through the interplay of social protection and child protective services, and how we think more broadly about trying to improve the safety net and make sure that children are not left behind, and that we're really investing in human capital. I do, just trying to be abreast of time because I had so many interesting questions. I don't think we'll get to them all. But there was a question that I'm going to gear towards Ben, because I know you've worked on this topic. But there was a lot of questions about the, part of, when we think about, evidence, and part of it is to make programs more transparent to citizens and make more knowledge about these programs available. How do you think transparency, particularly about rights, about benefits programs, about rights, about what you're entitled to, how do you think it really, how can we improve this on the ground?
Yeah, so I think that's a great question. I have a couple comments on that. The first is, I think that, Rima is probably alluding to some work that we've done in Indonesia on this question, where we actually tested a government of Indonesia program that basically sort of mailed out to citizens information cards that basically said, here are your rights under this program. You're entitled to so many kilos of subsidized rice or whatever. And I should say that this was a great example of sort of linking evidence to policy. Sort of the government of Indonesia was interested in sort of doing this kind of these identification cards, but before they rolled it out at scale, wanted to know if they worked. And so we partnered with the government of Indonesia to run a randomized trial in 600 villages in 3 different provinces, where some villages got the cards, some did not get the cards, and the ones that got the cards, we tested out various versions. And found that sort of those cards made a huge difference. It sort of substantially increased the amount of just sort of mailing identification card to a beneficiary, increased the amount that they received by 25%. So substantially increased the functioning of the program, and based on that, the government then scaled them up nationwide. So I think it's an example of how both transparency can matter, and also an example of how building evidence can be an important part of the policy scale-up process. The other thing I'll say is I think that this need for transparency actually has some pretty important implications for design of programs in lower middle income countries, where some of these kind of governance issues can sometimes come to the fore. I often get asked the question, well, why do programs have such simple design, simple rule, why are they kind of all or nothing? A lot of programs, either you get the assistance or you don't, and it's not kind of graduated based on your income level, for example. I think the reason why the programs tend to be simple is actually related to this transparency question. That basically, it's a much simpler message for the government to be able to say, if you're getting the program, you get, 10 kilos of rice or $50 a month or whatever. That may not be maybe the optimal design from a purely economics, point of view. Maybe you'd want to give more transfers to people who are a little bit poor or whatever. But I do think that the converse is it's much simpler to give out those simple, clear, transparent messages. If you are on the list, you get this, and therefore people know exactly what they're entitled to. So I think that not only does the evidence as transparency is important, but I think it also has implications for the way you design effective programs.
Oh, thank you. So I think we have 4 minutes left, and unfortunately we're not going to be able to get to all the questions. I do want to mention some of the questions because I think they're very interesting, and for me, and just note that these are questions that I'm also thinking about, and it's very useful to hear that this is what people think is important as we're thinking about the evidence review and trying to put together. I think there were questions on thinking about the links between social protection and climate change. There are questions about, and unfortunately, I think we lost Curfew, because there were questions as well directed towards him about how do we think about the fact that even oftentimes we deliver these social insurance programs, but do people underutilize them, and why do they underutilize them, and how do we think about better optimizing these programs to hit the right level of citizen needs. I think there was also questions on things that I've worked on before and I still struggle with when we think about, what are the right kind of data that we should be using to think about poverty and to think about the delivery of these programs. Should we be using per capita consumption? Should we be using other markers of vulnerability, as Alejandra talked about? Oftentimes, one of the things that pandemic made clear is that administrative data can be a huge savior and help in designing these systems, but it's not enough, and we need to think about how do we bring in other information as well. So I think there were questions on that as well. But it's really highlighting for me the importance of a lot of these topics in terms of how we think about providing social protection to the most vulnerable of society. And for me, as I said, I'm very excited, and I know maybe I'm speaking for Lisa and Dan and Emily and Dan and everyone about the launch of the Social Protection Initiative, just because I really believe that as we're thinking about policy, and as we're thinking about the kind of social services governments provide, these are such key fundamental questions in the delivery of what governments can do. And so I really do feel like I'm excited about the launch of the initiative, and I'm just so happy that you're all here today to engage with us, and we'd love to get more people involved. And so I think I'll turn this over to Emily to say our goodbyes, but thank you again for being here today.
Yes, thank you very much, Rima. I'd like to give a big thank you to our speakers, Rima, Lisa, Kurfi, Alejandra, and Ben, and thank you to everyone that connected this morning. I will reshare my slides just so I can post the link to the Social Protection Initiative's webpage. Please do not hesitate to get in touch if you have any interest in learning more about the initiative or any ideas on how we can collaborate. We're certainly very excited to continue this new conversation and work. So thank you again for joining, and I hope you have a wonderful rest of your day.